think it's time that we discuss deep tissue versus deep pressure and how having a your massage doesn't have to be painful to be effective. Okay, because there are people that come in and what they're looking for is to feel like work is being done. You know, they're like, I'm not here just to relax. I don't want a foo massage. I want to feel like the work is being done. Bet we can do that. You know, sometimes people come in, they're like, I just want to relax. Bet we could do that too. It's fine. But when people come in and they're like, oh, I want you, what did they say? I want you to break me, or I don't know, break people or beat them up. That's what it is. I want you to beat me up. That's not my style. That is not a philosophy that I practice. I'm not the therapist for you. And it's taken me, 9 years as a massage therapist, almost 10 years. It's taken me to this point to realize, and it was actually in my first office, I shared with a practitioner, and she said, I hope you're at a point in your career where you feel like you can pick and choose your clients. And then this came to mind of being like taking on clients that want I want to be in pain, I want to hurt. I had a guy say, oh, you can work deeper. I'm used to crying on the table. You are not going to cry on my table. That is not how I practice. Your massage does not have to be painful to be effective. I am the proof of that, okay? Now, I do want to say we'll take a hurt so good. Okay? Sometimes when you're working in the muscles that really need work in them and you're using deeper or firmer pressure, we'll use firm pressure. Um, Clients will say it hurts, but it feels good. Like it feels like it needs that work. We'll take a hurt so good. But if regular painful, no. Some discomfort, yeah, we'll take that too, but it should not be painful, should not be near tears. You should not be laying there thinking, am I gonna have a bruise here tomorrow after this session? That is not how I operate. So when you're asking, but I do offer deep tissue because it's possible to use deep tissue. Deep tissue is a modality to get to the deeper muscles in the body. But you have muscles that are along the spine. You don't want firm pressure along the spine. You don't want that. So there are techniques that you can use to get deeper into the muscle without having to use firmer pressure. I know, but it's the thing. I promise you, you can do it because I do it all the time. But that's why I offer Swedish deep tissue and trigger point because no two bodies are alike. And it's kind of one of my favorite things about massage therapy is that everybody is different. You know, this is where the traps is supposed to be. This is where the ROMs are supposed to be. This is where the hamstrings supposed to. But on every person, the shape, the size, the density of those muscles are completely different. So you need, in my opinion, it's best to have multiple modalities, multiple techniques to be able to get into those muscles because no two bodies are going to respond the same way to massage therapy. And even from session to session, the same client's body is not going to respond the same. This is why I love my therapeutic massage packages because you buy a package, one time purchase, and now we've got multiple sessions to work with these muscles in whatever state they may be in at the time that you walk in. So, all of that to say, all deep tissue is not always going to be firm pressure, but generally firm pressure is going to give you some deep tissue work. Massage therapy does not have to hurt to be effective. And if you are in pain on the table, please let your therapist know. I promise you, I can't promise you that. I'm sorry, I can't speak for everybody, but I have a good understanding that most people will not be upset. Please communicate with your therapist. If whatever style of technique they're using is painful, uncomfortable, you're kind of like, what's going on? What's this? Please communicate that with your therapist. If you need more pressure, less pressure, I always tell, especially my new clients, like, you're new to me, I'm new to you. Intuitively, I'm going to go with what your muscles give me first in regards to pressure, but it's your body. You let me know if you need more, if you need less. Sometimes the low back can take more pressure than like the hamstrings or the IT bands can. Like, it depends. Even in that one body, pressure can vary from muscle group to muscle group. So always communicate with your therapist. Therapists check in with the clients, help them out. Um, but basically, massage therapy can be an effective tool for your wellness routine, for your self care routine. So I hope these tips or a little bit of advice will help you in communicating with your massage therapist moving forward.